Let's talk about eyelid surgery. When we're mentioning eyelid surgery, it typically involves treatment to the upper and or lower eyelid. The term we use is blepharoplasty, so it's going to be either upper blepharoplasty or lower blepharoplasty. Patients come in seeking upper blepharoplasty that feel like they have heaviness to their eyes, and this can be due to excess skin in that area, fat, or sometimes even the brow has come down a little bit. So based on our analysis, we can come up with a treatment plan to adequately improve this area. Oftentimes, an upper blepharoplasty can even be performed in the office under a local anesthetic. It often takes us about 45 minutes. Afterwards, you're going to have some sutures that will need to get out somewhere between 5 and 7 days. You'll have some swelling as well as the possibility for some bruising, so you have to account for that. Once the stitches come out, you can put a little concealer makeup on, which can help hide any bruising that you may have. No real physical activity for about 2 weeks, and then we'll gradually let you start to resume your activities. With regard to outcomes, it does take about 2 months for all the swelling to resolve, but you'll see some very positive changes early on. Some patients elect to have their lower eyelids treated, and even others have both of them treated at the same time. Let's talk a little bit about lower blepharoplasty or lower eyelid surgery. That addresses 3 different components of the lower eyelid: the skin or the surface changes, the underlying muscle, and then the fat. We have fat around our eye, it protects it, but over time there's a membrane that holds that fat in place, and it gets weakened and that fat can become a little bit more prominent. So with the lower eyelid surgery, we can remove a little bit of that fat to help get rid of the puffiness around the eyes, and then we typically tighten the muscle around it to help flatten that out and shape the lower eyelid better. And then the last thing we can address is the skin. Sometimes we remove that skin with a little incision underneath the eyelashes, and then sometimes we even treat it with a laser or a chemical peel to help with some of the pigmentary changes. The lower eyelid surgery typically takes a little bit longer to recover. It can take at least 2 weeks before a lot of patients have swelling to the point that they're comfortable going out. And we do kind of tighten that lower eyelid so that it's supported to decrease the risks involved with that procedure. What we expect afterwards is a nicer shape to the lower eyelid, less puffiness to it, and then a smoother skin surface as well. When we're evaluating the lower eyelid, we also want to take a look at the cheek, because those two go hand in hand together. When we lose a little bit of volume in the cheek, that can accentuate some of the aging process of the lower eyelids. So that may be something that we talk about when you come in to discuss a lower eyelid surgery or a lower blepharoplasty. These operations take about an hour to an hour and a half each. So if you were going to do them together, it would be about 2 to 2.5 hours. We can do an upper blepharoplasty or an upper eyelid surgery in the office under a local anesthetic. But if we add the lower eyelids, I often do those in surgery under sedation or a general anesthetic, because it's a little harder to get our patients comfortable under a straight local if we are doing the lower eyelids. Recovery is going to be somewhere around 10 to 14 days. As I'd mentioned, once those sutures come out, you can start to wear a little concealer makeup, which can camouflage any bruising that you may have. As far as getting back into physical activity, it's going to take you somewhere between 2 and 3 weeks, and then we'll gradually let you start to resume some of the activities that you like to do. It will take you about 2 months to get to your final result. During that time period, you will be massaging your incisions and helping facilitate getting rid of some of the swelling that you have. As far as risks, anytime we do surgery, there's risks for bleeding and infection. Fortunately, they're very rare in these kind of procedures. There's always a chance that we could have a little bit of extra skin on the upper eyelid that may require revision 6 to 12 months down the road. There is other very rare complications, including kind of a pulling down of the lower eyelid that oftentimes would require another surgical intervention. Fortunately, those types of complications are extremely rare. The scars often heal very well and many times are imperceptible within 3 to 4 weeks. So if you decide to get a blepharoplasty, either upper and or lower, how long are the results going to last? Well, these should last you at least a good 8 to 10 years and sometimes longer. There are many factors that go into outcomes following cosmetic surgery. Certainly prevention from sun exposure is key. Often fluctuations in weight can also make these results not last quite as long, but we should expect a good decade, maybe even longer, if you undergo one of these procedures. You know, one of our central goals is to preserve your appearance. While we want to turn back the hands of time a little bit, we don't want to change your appearance. And that is very important when you're doing eyelid surgery. So it's really helpful sometimes to look at old photos, maybe 15 years prior to your visit, just to kind of see where you were about that time. And that's really the template that we'll use to try to recreate that look as we consider cosmetic surgery. Our goal is to make you look as good as you feel. We don't want to change your appearance. We just want to make you look a little bit better.